Good morning, students. Today I am going to discuss you a new topic in the central nervous system infections, that is tetanus. So in the last few classes we studied about acute and chronic meningitis. Today I'll be dealing with a infection which is commonly uh, occurring due to the toxin produced by a gram-positive bacteria called as Clostridium tetani. So we will go in detail of this topic. In the learning objective, at the end of the session, the students will be able to understand what is the pathogenesis, mode of transmission, clinical manifestations, epidemiology, lab diagnosis, treatment, and prevention of tetanus. Along with that one, we will study about the prevention of neonatal tetanus also. Coming to the topic, tetanus is an infection which is produced by Clostridium tetani, belongs to the gram-positive spore-bearing group of bacteria. It is a obligate anaerobic bacteria which require strict anaerobic conditions to grow, where in the morphology the bacteria possess terminal round spores which resembles like a drumstick in nature. So the spore is the bacteria will be seen as a drumstick in appearance when you are observing under the microscope. The tetanus, the terminology tetanus indicates it is a skeletal muscle spasm and involvement of autonomic nervous system disturbances. These particular spores are ubiquitous in nature, widely distributed in the soil, hospital environment, and intestine of the man and animals. So that is the source of infection for this particular bacteria. Coming to the pathogenesis of this bacteria, what are all the virulence factors produced by this bacteria? It produces two powerful exotoxins, namely tetanolysin and tetanospasmin. Tetanolysin, it is a heat labile, oxygen labile hemolysin, which does not have much role in the pathogenesis of infections, as well as, but on the other hand, tetanospasmin or tetanus toxin is a neurotoxin which is responsible for the muscle spasm in the person who is suffering with tetanus. These particular tetanospasmin can be toxoided in the presence of formalin. So it is also called as a formal toxoid. This toxin is coded by the plasmid present in the bacteria. What is the mechanism of action of this particular toxin? The tetanus toxin or the tetanospasmin binds to the receptors, that is the polycyanogangliosides on motor nerve terminals. This will cause the toxin internalization. After that, tetanus toxin will be transported in retrograde way to the GABA, that is the gamma aminobutyric acid and glycine producing inhibitory neuron terminals. This toxin prevents the presynaptic release of inhibitory neurotransmitters, glycine and GABA, that will be leading to the spastic muscle contraction, which is characteristic in the case of tetanus. How the infection is transmitted, what is the mode of transmission? The tetanus bacilli enter through injury which is occurring either superficially, the abrasions, or through the punctured wound, or while during the road traffic accidents, or the surgery which is done without any proper aseptic precautions, in the neonates during delivery and following abortions, otitis media where autogenic tetanus is possible. There is no case of non-infections. Uh, Person to person transmission is not recorded so far. What are the clinical manifestations? The incubation period of this particular infection ranges from 6 to 10 days. The shorter the incubation period, more the disease severity will be more. So in the beginning of the tetanus, the main muscles which are affected are the muscles of the face and jaw. The first symptoms to be noticed in the patient who is suffering with infection is the trismus or lockjaw, though the muscles pain and stiffness will occur. back pain, and difficulty in swallowing are the other symptoms what you can see. In case of neonate also, the difficulty in feeding is the symptom what is noticed. Coming to the second, this one that is continued. Painful muscle spasm will be there, which will be localized sometimes, involves the affected limb, or sometimes generalized. That is, muscle spasm can be leads to descending spastic paralysis. There will be sometimes autonomic disturbances such like low or high blood pressure, tachycardia, intestinal stasis, sweating, increased tracheal secretion, and acute renal failure. Coming to the second complications after the trismus or locked jaw, we can see the rhesus sardonicus, that is abnormal sustained spasm of the facial muscles that appears to be produce a grinning type of face. In the third complications, once the tetanus spasmin is activated, the person may go to a opisthotonous position, that is nothing but the abnormal posture of the body occurs due to generalized spastic contractions of the extensor muscles. So finally, the patient will die due to the respiratory muscle spasm. What is the epidemiology of this particular infection? Tetanus is more common in developing countries including India, mainly due to it will give a warm climate for the spores to stay in the soil, rural area with fertile soil, unhygienic surgeries or deliveries which are occurring, incidence decreasing due to the widespread immunization of infants and pregnant mothers. In the laboratory diagnosis, treatment started immediately based on the clinical diagnosis. Laboratory diagnosis will give you only supportive value. So it is an acute emergency condition. The clinician cannot wait for the laboratory result to confirm the diagnosis. Before that one, empirical treatment and other therapy should be started. What is the specimen to be taken? It is the excised tissue bits from the necrotic depth of the wound. So that has to be taken mainly to do the diagnosis. In the gram chain, you can see the gram-positive bacilli with a terminal and a round spores, which looks like drumstick in appearance. Where you can do the culture of this specimen. Culture is more reliable than microscopy. Robertson cooked meat medium, that is a biological medium which is used for the cultivation of Clostridium tetani. It is a proteolytic bacteria and the meat particle turns to black in color after producing a foul odor or pungent smell after the growth of the bacteria. Blood agar with polymyxin B can also be used, that is incubated at 37 degrees centigrade for 24 to 48 hours under anaerobic conditions. Clostridium tetani produces characteristic swarming growth over the blood agar plate. How you can do the testing of the toxins produced by this bacteria? As pathogenesis of the tetanus is toxin mediated, association of the isolated organism can only be established when the toxin production is demonstrated. That means mere presence of the bacteria in the gram smear does not indicate that patient is suffering with tetanus. So toxicity test has to be done to confirm the diagnosis. Toxin assay can be performed by in vivo mouse inoculation test or specimen serum and urine where this organism can be seen. Treatment of the tetanus mainly include the passive immunization. When the person develops the tetanus, the treatment of choice is human tetanus immunoglobulin, that is HTIG, ATS, that is the anti-tetanus serum, that is equine derived, which is given 250 international unit of HTIG or 1500 international unit of ATS in a single intramuscular injection is given. Duration of the protection will be last for 30 days and 7 to 10 days respectively for both the vaccinations. Coming to the treatment of tetanus again, combined immunization, both active and passive, is recommended in non-vaccinated persons. Antibiotics minor role as they cannot neutralize the toxin because I told already this is a toxin mediated infection. So using the antibiotics to kill the bacteria does not uh, does not help the patient to does not help the clinician to make the this one to survive the patients. Useful in early infection before expression of the toxin less than 6 hours to prevent further release of toxin by the bacteria. Metronidazole is the drug of choice since it is an anaerobic bacterium. 400 milligram rectally or 500 milligram intravenously every 6 hourly for 7 days is recommended. Penicillin can be given as a alternative drug of choice. Other measures include symptomatic treatment where endotracheal intubation is recommended when there is a respiratory muscle spasm, and early tracheostomy antispasmodic like diazepam to eliminate the reflex spasms. Beta blockers can be given to sympathetic hyperactivity. Surgical wound debridement can be done. Patient is isolated in a separate room. These are the other measures to be followed. In the prevention part, we can have the active immunization, that is a vaccine. Tetanus toxoid TT injection can be given as a monovalent vaccine prepared by incubating toxin with a formalin to toxoid. I told already that is a formal toxoid. Combined vaccine given in the form of DPT, TD vaccine or pentavalent vaccine. Primary immunization of children, tetanus toxoid is recommended. 3 doses of pentavalent vaccine, DPT, Haemophilus influenza B, hepatitis B virus at 6, 10 or 14 weeks of birth. 2 booster doses of DPT at 16 to 24 weeks and 5 years. 2 additional doses of TT at 10 years and 16 years can be given. In the adult immunization, if primary immunization is not administered in childhood, adults can be immunized with TD, tetanus toxoid, and adult diphtheria toxoid. Site of the injection is usually deep intramuscular route at anterolateral aspect of the thigh in the children, and in adult it is deltoid region. Antitoxin titer of more than or equal to 0.01 unit per ml is considered protective in nature. In the last part, the prevention of neonatal tetanus. Neonatal tetanus is definitely by the WHO's, it is defined by the WHO's as an illness occurring in a child who is loses ability to suck and cry between day 3 and 28 days of life and becomes rigid and has spasms. Also known as 8-day disease, as the symptoms usually start after first weeks of birth. How we can prevent it? Most common reason is the unhygienic practices during deliveries, infected umbilical stumps due to application of cow dung, rarely by circumcision or by ear piercing. These are the practices which can lead to this particular neonatal tetanus. Seasonal July, August and September months is more common to occur. Discouraging home deliveries and promoting hospital to or attended deliveries is recommended. Following aseptic clean practices are followed during deliveries. Clean hand, clean surface, clean blade for cutting cord, clean cord tie, clean cord stump, clean towel and clean water are recommended to prevent. TD2 doses all pregnant women during second trimester at a 1 month gap has to be given. The elimination of this particular infection is based upon less than 1 by 1000 live birth in every district of country. TD coverage to pregnant women is more than 90%. Attended level, deliveries is more than 75%. In the India, the situation is India has achieved the elimination status for neonatal sepsis tetanus as declared by WHO in 2016. In 2018, around 129 cases of neonatal tetanus were reported in India compared to 1,803 cases in the world. That is about the tetanus chapter. I will deal with another topic of the central nervous system infections in the next class. Thank you for the patient listening.